In this part we will highlight how Ignaz Semmelweis and Florence Nightingale introduced hygiene and cleanliness into clinical and institutional settings, drastically reducing infection and death rates, laying the foundation for infection control in public health and healthcare. In the mid-1800s, hospitals were dangerous places. Patients often died not from their illness, but from infections they picked up during treatment. Then came two pioneers who changed everything, using soap, water, and science. First, Ignaz Semmelweis, a Hungarian physician working in a Vienna maternity ward. He noticed something strange. Mothers treated by doctors died of puerperal fever far more often than those treated by midwives. The difference? Doctors performed autopsies before delivering babies, without washing their hands. Semmelweis made a bold move. He required doctors to wash their hands with chlorinated lime water between patients. The result? Death rates plummeted, from over 18% to under 2%. But here's the tragedy: his ideas were rejected. Many doctors refused to believe they were the source of infection. Semmelweis died before his discovery was fully accepted. Now, let's shift to Florence Nightingale, a British nurse during the Crimean War. She arrived at overcrowded field hospitals where wounded soldiers were dying, fast. But they weren't dying from wounds. They were dying from filth, poor ventilation, and contaminated water. Nightingale cleaned the wards, improved food, and insisted on hand washing and fresh air. Within months, death rates dropped dramatically. She didn't stop there. Nightingale used charts and data to show that sanitation saves lives, and she trained thousands of nurses in these principles. Together, Semmelweis and Nightingale showed the world that cleanliness is prevention. Their work sparked the rise of infection control, hospital hygiene, and the understanding that simple actions, like washing hands, can save millions of lives. Next, coming up in Part 8, we'll move to the US and meet Lemuel Shattuck, the man who laid the blueprint for America's public health system.